Hey everybody, this is Dr. Joe Borio with Change Your Health, Change Your Life. Hopefully everybody had a nice Memorial weekend. Hopefully everybody ate exactly like I've been teaching you to, right? Probably not. I didn't either. I had a little bit of stuff myself. Moderation's key, right? As long as you're not making that stuff, putting that stuff in your body on a daily basis. But we've been getting a lot of emails in lately with a lot of questions for me about different health topics and different types of health issues that people are being challenged with. So I thought today I'd maybe address one of those with you. If you have a question for me, you can certainly go right to the website, which is Dr. Joe Borio, so drjoeborio.com, and then I'll bring you right to the office website, and up in the corner there's an email, so you can email us. You can also subscribe to our free web videos as well on that site. But that being said, I'd gotten an email from Carol, and Carol was asking me ways to lower her blood pressure. It's such a common issue. You know, a lot of people don't realize that high blood pressure, we've heard, can cause heart disease. We've also heard that it can cause a stroke. That's probably the biggest thing that you'll hear out there. But we also don't hear enough about the fact that blood pressure medications, what are called angiotensin reuptake inhibitors, are beta blockers, or the last one would be, it's different types of IZIDs, which are diuretics. A lot of these drugs can typically cause a lot of other health problems. For example, the diuretics that the medicine uses to treat blood pressure, they're very prone to causing gout. They're also prone to causing uric acid. They throw off the electrolyte balance in the body. Angiotensin reuptake inhibitors tend to be very quickly adapted to by the body. So what happens is somebody gets a blood pressure pill, and after a while it doesn't work anymore, and then you're on another blood pressure pill, typically a blocker. So they'll usually do an angiotensin reuptake inhibitor, then they'll do a beta blocker. Same thing with a beta blocker. Those block beta receptors on all different parts of the body, so your libido, sexual libido goes down, you can get tired, you can feel lethargic, you tend to gain weight. And angiotensin reuptake inhibitors cause a lot of damage to the kidney. So again, blood pressure pills sometimes are thought to be this kind of inert issue, when in reality they can be very dangerous and deadly. They can be toxic for the body, especially long-term use. So that being said, it's better to understand why are we having blood pressure problems in the first place, and let's try to get at the cause of it. Now, sometimes there is a genetic proclivity. People have a tendency in certain families to have a higher pressure, and there's certain changes in the body. So let's talk about, you know, the majority of people that basically have a developmental blood pressure issue as they get older. Number one, remember that pressure in your system, the ideal is 120/80, and 120/80 is there to get enough blood, which carries what? What's in your blood? Oxygen and nutrients, right? So it's trying to bring oxygen, and it's trying to bring, if you will, building materials to different parts of the body, okay? And the higher the pressure typically means that's not the problem. The pressure's higher because you're not doing enough, or you've got a larger mass for your body to put pressure through. So your body will deliberately, on purpose now, intelligently increase the pressure because, man, I'm having trouble getting that oxygen and nutrients out to the entire body. Now, one of the ways to lower blood pressure immediately, and it doesn't even have to be weight loss, is by you actually walking or moving. And by moving, what it does is it increases the circulation, and it brings oxygen, which is the definition of exercise, oxygenation in the body, and nutrients to the body. So just doing a low-grade 15-minute take a walk. You don't have to go to a gym, though gyms are great. You can do a bicycle, you can do a walk, you can do a pool, you can walk in your house, go up and down the stairs, different things. Park further away when you go to the store, whatever. I mean, simple little things that you do on a regular basis, and what that'll do is that'll automatically help lower the pressure. Number two is our mass. Now, certainly for those of us that are getting bigger, we find that the bigger the mass is and the less active, that usually goes along with less activity, the pressure will go up. So a simple way to lose weight, the simplest way to lose weight is certainly do more, eat less, right? We've heard that before. But I'm not going to say eat less in the sense of starve yourself. Eat less of the simple processed foods. I'm telling you, you've heard me say it a million times. Reality is anything that's processed, white flour, white sugar, breads, cookies, cakes, and candies, things that are in the middle of the grocery store, if you will. Those things tend to be frozen foods and so forth. And it doesn't mean never, guys, but the reality is you can't make that a main staple of your diet. You want to make sure you're eating living food. Remember, lastly, that the last meal of the day, typically the dinner, should have virtually no carbohydrates. So, you know, I myself, sometimes you get into that habit of having a little this and a little bit of that, and boy, it doesn't take long for you to find out, geez, you know, I put on a few extra pounds, and the fastest way to get that off is to eliminate the carbohydrates at night. So if you're somebody that has a little bit of a sweet tooth and you're gonna put some of that in you anyway, try to have that during the day, not at nighttime. A couple other good points. Number one is the nutrients. We find that minerals of the body help lower the pressure because they help keep the balance of what they call electrolytes in your body. So are you on a good multivitamin? You know, most of that comes down to eating well and healthy, but if not, a good multivitamin with multivitamin with antioxidants is a great way to supplement what you're eating to make sure you're getting all those good healthy nutrients in your body. And we talk about the nervous system. A larger study came out of the Journal of Human Hypertension. It was in 2008, and it was a study on blood pressure and the nervous system in chiropractic care. And what they showed was that the upper neck had a significant role in addressing blood pressure issues. And if the upper part of the neck was either out of alignment or stuck, what it did is it turned on a certain part of the nervous system, and that's not to get complicated, but it's the stress response of the system or the sympathetic system. So it turned that part of the body on, and what happened is the pressure went up. Kind of like the part of the system if you were going to go for a fight or you're going to run away. It's called the fight or flight system. And in either one of those cases, your pressure will go up because you're going to need more oxygen and nutrients. And what they found was that that's also turned on by this area if it's not healthy. So real important to evaluate that if you have blood pressure issues. Evaluate that by a chiropractor to specifically measure that area to see if it is out of alignment, how bad is it out of alignment, and then determine the best course of care in order to correct that misalignment. And often that's going to take several adjustments over a period of time, at which point, just like your teeth now, and you've heard me say this for many years now, you're going to need wellness care, which is kind of like dental care of your spine, where you need to go in and get adjusted on a monthly basis or more in order to keep the nervous system healthy. So hopefully those tips will certainly help you out in addressing blood pressure issues. There's a great email. I certainly encourage anyone else to send me some emails. Again, just go to Dr. Joe Borio, drjoeborio.com. That'll bring you right to the website. Got all kinds of great video topics there, and you can enter your email. We'd certainly love to have you part of our practice. If you're local, we're right in kind of that Syracuse area. If not, by all means, you can email me. Tell me exactly what you're looking for specifically, and we'd love to recommend a good chiropractor to you in your area. And I'm certainly affiliated with some groups. Should be able to find somebody to help you out and take really good care of you and your family. With that, let's close with our normal closing, which is make sure you guys eat well, right? Exercise, good water, right? This isn't going to change. Make sure you're good to good night's sleep. Make sure you're putting good thoughts up here in your head. Make sure that you and your mother and your father and your grandfather and babies and grandma and grandpa and everybody in between and all your coworkers, we really got to get everybody under regular chiropractic care to make sure that the nervous system, the computer, can talk to the body and keep the body working just like it's supposed to. Guys, focus on your health. Spend time with your family. Have a great week. I'll talk to you guys in a week or so. Thanks.